Hi, everyone. We're back again, and I'm here with Dr. Amanda Olson today. She's a pretty special guest for us because, well, there's a lot of reasons actually. She's a pelvic PT, she is an entrepreneur, a woman powered business with great ideas. So, welcome, Amanda.
Thank you so much, and thank you for having me.
Yeah, I'm so glad that you're here, that you're taking time out of your busy schedule to do this. So before we get started, I want to kind of celebrate you a little bit and read a little bit about you for our listener. So here we go. Dr. Olson earned her BS, her Bachelor of Science, from Pacific University, and her doctorate in PT from Regis University, graduating as a member of the Jesuit National Honor Society. She holds a couple of certifications, both in pelvic health, the certification of achievement in pelvic floor physical therapy and from APTA, and then pelvic floor practitioner certification through Herman and Wallace Institute. She's also certified in Pilates and a certified running coach too. I learned something new. I didn't know that. Yeah. She's the president and chief clinical officer of Intimate Rose, where she develops pelvic health products and education. Obviously, she's very passionate about empowering women and men with pelvic health issues, including pelvic pain, incontinence, pregnancy, and postpartum issues, and kind of all people with the pelvis.
All the people.
hmm all of them. So I'm going to make sure that we put where we can contact you in our show notes. That's intimaterose.com and on Instagram, Intimate Rose and A Olson DPT. But I really want to hear your story first. So just tell us about yourself. And my question is, what got you fired up to take such a big leap? Because starting a company is not a small thing.
Yes. Well, interestingly, so I am a pelvic health physical therapist, and I'm also a mom. But before all of those things, I took a big leap off of a cliff. And
Oh
I was
my.
at the time a pediatric specialist, and I specialized in pediatric physical therapy. So had a
Oh.
doctorate degree, had gone to PT school expressly to specialize in pediatric neuro. And I found myself as a new practitioner out in nature here in Oregon. It's very beautiful. And I was in a group of young men who were cliff jumping and jumping off of a cliff into the water at 40 feet. And I don't know why, but I decided to join them. And apparently, when you jump off of a cliff, you're supposed to land straight. And I landed in an L bottom first
Oh.
at 40 feet. And that caused significant injury. I was very, very, very badly hurt. And really and truly, if I had rotated a little bit more and hit my head, I would be gone. So I'm very lucky. I came
Wow.
out of it okay, but with significant injury to my low back and pelvis. And I had to go see a pelvic floor colleague. And this was, gosh, now it's been like 15 years since this happened. Back then, there was a couple hundred in the country. Pelvic health physical therapy has grown so much, and I just got so lucky that we had a phenomenal one in Portland, Oregon, where I lived.
Yes, you did.
And yeah, we have a
Yeah.
great team there. And I went and I got treatment, and I went through the process, and she totally changed my life. I went on to run marathons, have two babies vaginally. For all intents and purposes, I'm fine, but it completely changed my life. And she told me, Amanda, you need to quit peds. You need to do pelvic health. You have the right personality for it. There's not enough. We need more practitioners. And so I did. And I
Oh,
went back
wow.
and I recertified. And, it took several years to board certify
hmm
and all those good things. And then I was a practicing pelvic health clinician, and I was one on one, and I was in the treatment room all day, every day, hearing people's stories and seeing what was working and seeing what wasn't working. And I recognized that there was a need to create products to help empower them at home and beyond after they've discharged, or as a means of, self-managing their symptoms even while they're in therapy. And I wanted them to be really, really comfortable. And I also wanted them to be cheerful and bright and easy to use. And that's where Intimate Rose was born.
Wow. I had no idea it was a literal cliff. I thought this is going to be a fantastic story. And it actually was a cliff. Wow. Oh my gosh, I can't imagine going through that. But to have used that experience to launch what you did is incredible, is really amazing. And so I'm just kind of taking a pause for that to kind of digest that story a little bit. So, what was just to revisit your story for just a moment, for those who are listening, and you made 2 points. One is 15 years ago,
Yeah,
um, there wasn't a lot of pelvic PTs. And 20 years ago, 25 years ago, there was even less known about pelvic therapy at all,
yeah,
much less having any tools or anything like that. So, for those of you listening, I never want anybody to beat themselves up and go, oh, I should have gotten pelvic PT. Well, honestly, things, it's only been available recently, honestly, and there's still not enough of us, and it can still be hard to access and hard to find, that kind of thing. So you really did get lucky to be in a place where you could actually even find pelvic PT. There are plenty of places in the country that there's not a pelvic PT in the Tri-County area, and you have to drive. So what was your process from beginning to end, in treating that injury? How long did that take? And what were some of the things that you took out of that experience that helped you just launch your company and where you are now?
there was there were so many lessons. There was two really key, I think, life that changed me as a clinician and changed me as a person. And one is I was in therapy weekly for about 3 months, which when I look back now as a clinician, I'm like, wow, I scooched right through that. That's a relatively short time, but I would say the healing process took more like 6 to 9 months, where I was still doing a lot of my own at-home treatment after I discharged. And the fact that I was already a physical therapist, I was very adherent to my program. I was able to put that into my schedule. All of those things worked for me. So that, I think, is attributed to that short period of time. But the healing process took considerably longer to really get through and feel like myself and get to the point where I was running marathons again, and then years later having children. So one is that healing phase takes time, and that can be compounded. Mine was a fresh new acute injury that can be compounded when it's a more ongoing issue, or there's
Yeah.
other injuries or other issues happening at the same time. And then the other one was, it was a very humbling experience to be in a vulnerable position, to be the patient on the table in that regard. I am the kind of person who, I don't cancel dentist appointments. I don't not show up for my appointments because I'm able to attend and I'm able to get myself there. I know there's a lot of social factors that come into people's schedule that create reasons where they can't necessarily attend. But I want to be honest when I say, the first month, every day that I had therapy, I strongly considered canceling my appointment because I didn't want to
Yeah.
do it. And it is hard. And, it's not, it is a vulnerable thing. My therapist was very gentle. She provided wonderful treatment. I'm so thankful that I was able to push through, but it was extremely humbling. And that has changed me as a clinician too. So I have a lot of empathy and understanding as to why it's really hard to get in the door in the first place, and why getting the wheels turning and getting the therapy process in motion is really challenging for people. And I haven't really admitted that a lot out loud, but yeah, she was phenomenal. But every single day I had to like really give myself a solid talk about, you are going to your appointment today. You are not going to cancel this appointment.
That's such an important thing to mention, because I think it would be easy to assume that we're PTs. We go to our appointment. If we need our own pelvic PT, yep, we got to go find one. You can't do your own pelvic PT. And so it's really important to kind of admit that universally we're all going to struggle with that, especially if there's also been trauma. Like, a lot of women experience trauma inside the healthcare system, and that makes it even worse. They're much more likely to say, I can't do this, because they've already experienced harm inside the system already.
Yeah, absolutely. And so by the time they get to us, I like to really support them and remind them that they've done a great job of just showing up for themselves by showing up to their appointment that day.
Yeah. Yeah. And that kind of segues too into like your mission for creating Intimate Rose is to have the all the tools and the toys in the toy box. I have a little rolling cart and I have a bunch of your stuff on the cart and I roll it around. It's like my little toy box to make them approachable, accessible, affordable, all of that. So tell me, and I know a little bit of the backstory because I came to pelvic PT from ortho, so in ortho, we have all these tools and tricks of the trade, and we have magazines that are like hundreds of pages deep with all these tools in them. But we didn't have that. We had nothing in pelvic PT. So tell our listener a little bit of the backstory about how that came to be and kind of what pelvic PTs had to do starting out before we had some of these tools.
I think we as physical therapists, we're used to being MacGyvers anyways, and coming from a pediatric background, it's bubbles, it's balloons, it's toys, it's all those other things that you do to make therapy fun.
Mhm.
And I think that mindset has definitely helped in the creative process. And certainly I hope it's reflected in the colors and the choices that I've made. But yeah, the whole company started with one product, and it's kind of just one foot in front of the other. So as soon as one thing is created, I'm thinking about what else needs to change. And I always had my eyes set on pelvic pain. But to start with, we started with vaginal weights. I have a business partner who I'm very lucky to have. He's very helpful on the business end, and also just in terms of technology and getting things to go. And so together we thought through the process of making something that's easy and understandable to use. And then from there, very next thing was dilators. I wanted dilators that had that smooth silicone. It's a very unique type of finish, and that were very gradual and had a lot of support behind them. And so with the company, each product comes with step-by-step instructions, but also on the website for free, we have hundreds of different resources there to help people if they get stuck on, if X, then do Y, or I'm having trouble, with this particular section of my therapy. So we are providing that on the tech side on the website. And then the next thing to come was wand, and one wand became four wands, and
That's right.
it just kind of grew from there.
So, tell everyone about what each of those products would be particularly, used for when they might actually need them.
Absolutely. So wands and dilators are both tools to help people who have pelvic pain. Dilators are specific to people who have insertion pain. So people with a vagina who are having insertional pain with tampon, speculum exam, intercourse, that need to retrain their brain and their pelvic floor to be able to drop and relax in order to not just tolerate, but have zero pain, and when the goal is intercourse, to be able to actually enjoy penetration. So they start very small. They start the size of my pinky, and they gradually and slowly incrementally get a little bit longer and a little bit wider. So we have these silicone tubes, and the person is engaging with their whole body. They are learning to understand what signals their body is giving them in the sensory realm, and they are learning to use like a top-down approach of learning to coordinate the pelvic floor. So that includes breathing. It includes different body positions in order to be able to relax the pelvic floor, and then getting the vaginal canal used to having something in there. And then the wand I specifically created, there are two different ends. All four wands are the same shape and size, but each different wand has a different function. So either end can be used vaginally or rectally. For people that are needing to use it rectally, there's a long, thin end that can be inserted and used to do myofascial release, tender point release, working with any scar tissue they may have or restrictions or discomfort, and also as a tactile cue inside the pelvic floor to be able to properly locate them. So again, still working with the brain, still involving the coordination system, but as a means, just like if you got a knot in your back or your neck and you used a Theracane, borrowing from the orthopedic realm, to
Mhm.
release that tissue and to get that tissue to relax and be mobile and flexible again. That's what the wand does. So the two different curves can reach into the intricacies of the pelvic floor behind the bladder and off to the very far side of the pelvic floor that backs up to the hip, and then also deep into the back half of the pelvic floor as well.
That says that you said the last thing you said was pretty important that I think I want to repeat to the listener, and that is for getting to particular points of the pelvic floor. So, all of these things are obviously good for the pelvic floor. But then you said two other things that I think people may not realize are interconnected quite intimately. And that is that the wand can reach areas that back up to the hip and that actually are involved in hip function, strength, even relaxation of those muscles. We don't often think of muscles needing to relax in the hip, but if they don't, then that can really flare the pelvic floor. So if you have hip pain, these tools can be really good for hip pain. And then the other piece of that is sacroiliac joint dysfunction, tailbone pain, and back pain. People may not think of, the pelvic floor influencing back pain or vice versa, or is it a chicken or an egg thing? And so if you have back pain, SI joint pain, hip pain, tailbone pain, um, then the tools can actually go a long way, and no pun intended, in helping you reach those. I tend to always do that, and it's
I
always by
love
accident. Um, to help you reach the spots you need to reach, because back pain isn't just always back pain.
Absolutely. They are a team.
Unfortunately, and fortunately, because it means there are multiple variables that we can treat. And the ones that we can't reach, that's what these are. The tools are really wonderful for that. But yeah, I wanted people to understand that because oftentimes, if you are in the orthopedic realm, they're not thinking about pelvic health. And so you could end up in an orthopedic office, or a PT or surgeon, and it's being limited to just, oh, it's just hip pain or it's just back pain. And that's why I think we need the intersection of orthopedics and pelvic floor, which is what I appreciate coming from orthopedics into the pelvic floor, realizing, oh my gosh, there is so much that we treat in orthopedics that really is just a pelvic floor problem or a pelvic health problem.
Absolutely.
Yeah. So I hope that, that helps you guys feel a little bit better, that if you're struggling with chronic low back pain, maybe it's time to look into the pelvic health origins of that. There's probably a contributor to it, or hip pain being the same way. And in a really far flung way, I'll mention this because I end up talking about it a lot, is that I see changes in the pelvic floor changing people's voice,
Yeah.
or their voice actually changing pelvic floor um, tone, mobility, strength, that kind of thing. So I see lots of interesting things about that day to day, doing, imaging and that kind of stuff. But I see you're shaking your head too. So what's your experience with that?
Yes, it's so interesting. The first time I had heard about that concept was in another PT course, and it made perfect sense between the relationship of the diaphragm and the pelvic floor, and that creating a pressure system. And when that pressure
Yeah.
system is disrupted, it's certainly going to affect beyond the diaphragm. We get so locked into our region that we care for as clinicians, and to think about the segment above, above the diaphragm made perfect sense to me. And then I started observing it in my patients. And I remember I very specifically had a patient who was female who had come in with very low pelvic tone. And her voice was it was very scratchy and it was
Mm,
very light. And she had a lot of trouble projecting to speak. And
yeah.
through the course of our therapy, that improved. And it was such a light bulb moment for me. It was just so interesting. And that makes me think we need to have really good relationships with our speech therapists too.
That's right. That's right. Because, historically, both therapies stopped at the respiratory diaphragm. Speech only went to respiratory, and pelvic stopped at respiratory.
Yeah.
And there's not much exchange. So I'm excited about what I see in the clinic and what I'm teaching day to day too with the voice to pelvic floor connection. But, so if you're listening and you have a voice issue and you also have a pelvic floor issue, they are probably intertwined in some way. Um, and then the other thing that's pretty cool about it is that I don't know if your tools have been used this way or intended to use this way, but certain hertz frequency helps with vocal restoration and preservation. And so I've actually used your vibrating wand on the laryngeal area
That is
for,
amazing.
yeah, for restoring vocal function and having it help people to treat the vagus nerve, not just the laryngeal area, so that they not only can voice better, but they're not perceiving as much anxiety and kind of angst. So yeah,
That's incredible. Where do you have them place it?
it's over the cricothyroid junction, yeah, area, because it should vibrate equally bilaterally, but it doesn't in a lot of people. So once we go into this area and then palpate it, if I find that it's not vibrating equally on one side versus the other, you can use your TheraWand. The vibrating one, though, right? That one's the
Yes.
teal one and the purple one, or
Blue.
the blue
Yes.
one, the blue one and
Blue
the,
and
okay,
turquoise. Yeah.
blue and turquoise. Okay, yeah. And I have the turquoise one at the office, and so yeah, I've been using it for other things, all pelvic floor related, but
That's incredible. I actually at a conference once had another orthopedic therapist come up and say that they had discovered my wand and they were using it for TMJ
yes,
to
yeah.
help manage
Mhm.
TMJ patients.
Yeah,
And
you could
those
probably
two
get
are,
mhm.
yeah,
So
yeah.
related. So yes, that whole pterygoid TMJD population and muscle tension dysphonia, chronic hoarseness, laryngitis, and then breath sustaining. People who have to worry about sustaining the breath. I call it sustaining the phrase, which if you're singing, if you're a instrumentalist, like woodwinds, brass, I mean, you got to hold that note for a long time sometimes. And when I'm imaging, what I'll see is that they can only sustain a note. Like I'm working with some vocalists now, and the sustaining the phrase was like 6 seconds, which is not long enough to even, if you think about how long you can talk before you have to inhale, it's longer than 6 seconds,
Yeah.
typically. But in not being able to sing more than 6 seconds, you can imagine that's pretty limiting on what you can do as a performing artist. So yeah, I've been using some of the tools to help them increase their, sustain their phrase, whether they're singing or playing instruments. Yeah. So your company's doing so much good
I
in
love it.
the world. Yeah, all the way across to performing arts. Um, so now that we kind of have a better idea of like how this launched, because, honestly, and I've still had to order some pelvic health models from like um, going incognito on a website to go to a sex shop or something like that, um, to order models for demonstration purposes to teach people how to use the tools, because there's just not anything out there. So all this, if you guys knew the whole backstory, it's funny, but it's not funny, because at the same time that we're shopping all the stores, as pelvic floor PTs, that's also speaks to how much help people weren't getting, because if there's no tools for it, then who's getting educated? If it's being relegated to, taboo topics, and historically it has, then people are thinking they've got to suffer from pelvic pain or whatever it may be, leakage, because it's what happened to their mom or their grandmother or another person, And so this conversation too, I think, is very much about talking about the stuff that we haven't talked about.
Absolutely. And that is the hill I will die on, is especially when it comes to classification
Yeah.
of our tools and of,
Yeah.
products that are enabling people that have sensitive pelvic health issues that they may already have feelings about. And then when they go to search for their tool or their item, and they're seeing a visual stream of all those
Yes.
sex products,
Mhm.
that can re-traumatize them, or it can make them think that the medical problem that they're trying to address is a shameful one, and
Right.
thrown in with whatever feelings they have about those. And so we have fought a lot with Amazon and with Google and with Instagram and Facebook and Meta to ensure that the right people are seeing these in the right classification, which is as a medical tool, and that helps to protect people in their search for their solutions. And especially ones when their provider, whether it's their pelvic health physical therapist or the urologist or gastroenterologist, has told them to go buy this thing, and then the thing is thrown in as an adult item and they're being shown all that, it creates a lot of doubt, and that can really tear at the threads of their trust in the medical system or in themselves.
Yeah.
So
Yeah, absolutely. I don't know if there's like a recent experience or a personal story you can draw from to just kind of, I don't know. I want to elaborate on that a little bit more because I think it's so important that we destigmatize this, that we talk about these things. So it's not a direct question so much as, is there another way that we could elaborate a little bit more to just help people normalize the fact that everyone has a pelvis and you're going to have an issue with it? More than likely, if you don't, amazing. You know, you're an exception to the rule, but most of us are going to have some kind of pelvic issue. What did you come up against early on where you realized, holy cow, there's pushback to this, you know, and
yeah.
how did you overcome that?
The two biggies were actually like very big situations. First was Amazon notified us over a series of times, multiple times, that our product was classified in with the rest. You could find, just the same way you could buy toothpaste on Amazon, you could find our pelvic health tools. All of our images are very, I would say, professional and appropriate. We don't ever, there are some companies out there that really like to like push some of the boundaries, and they
Hmm.
take creative imagery to a different direction, and that's totally fine, but that's not a direction that we have ever taken. And Amazon notified us that they were going to classify our products starting on a certain date as an adult product, which means that in order for somebody to find our product on Amazon, they were going to have to testify to being 18 and older, and then they were going to enter like the back end sex shop end of Amazon, where there would be very explicit imagery, and then there
Wow.
would be our beautiful white
Yeah.
image of our
Your
product
clinical
and my
shot
clinical
of,
me in
hmm,
there. And it's not to say be in that sex shaming frame of mind or say that sex is bad or those
right.
products are bad, because they are not. But when someone's not in that frame of mind and they're looking for a tool to help with pelvic pain and they have a history of trauma, that is a terrible user experience. And
Hmm.
it was enraging for myself and for all the other clinicians that knew that this was happening. And so we fought very, very hard. We wrote letters to the highest levels within Amazon. Anyone that will listen, they did not listen. Somehow or other, we've been able to fight through that for the last 3 years. And most of our products are readily available on the regular Amazon side. But because of that reason, we have worked very hard to keep our website shoppable so that people can go direct, and that they can be buying there. We do 2-day shipping just the same as Amazon. So there's really no need to send them into that environment. And we've just worked very hard to make our website inviting and very welcoming.
And it is.
Um, oh, thank you.
It is. It absolutely is. Yeah.
So that was a big one. And then the other one was Meta, and it was Facebook. So a really interesting thing, again, with our white images and whatnot, we were banned from being able to make ads on either
Ugh.
Facebook or Instagram. And then, so I have a male business partner, and he shared screenshots because we actually entered a collaborative with other women's health and men's health brands. Men's health products are extremely explicit, and they are popping up. So his were unspeakable. Some of the ads that he was being shown were unspeakable. And our ad of a man and a woman hugging with their clothes on was banned from
Wow.
Facebook.
Wow.
So, so that was another another way that we advocated, we wrote letters. Senators got involved. Hillary Clinton got involved.
Oh
She
my God.
reposted about it.
Goodness.
And that's not to be political. It's just to say that there
Yes.
are people that are advocating and that are looking out, and we are really working hard to ensure that people don't feel shame about these
Yeah.
products.
I think that's important to mention because we live in such a divided world. It's not just country, a divided world now with um, everything trying to be politicized. And I always emphasize that healthcare is not like political dodgeball, or it's it's far more important than a political issue to have access to healthcare, and that healthcare and education are one of those things, just like clean drinking water, that it's not a political issue. It's just a basic human rights issue.
Yeah.
And so it's wonderful to see that we have we've had other guests recently who have experienced similar things. It all circulates around this idea that anything to do with the pelvis at all is taboo, or reproductive organs in any way is taboo, and that you can't talk about it, and there's no care for it. We just kind of been busting those things. But I just want to take a minute to kind of acknowledge that healthcare moves far beyond a political realm. Yeah.
It's
It's,
just people.
yeah. Yeah. It is people with a pelvis who deserve to have access to the care, to make it affordable. That's the other thing that I love too about what you're doing, is that the tools are accessible to people in a way that they don't have to start a payment plan.
Yeah,
That's really important. And it's not a scary thing. I still, the people that I will introduce things to, come to me, come to us, come to all pelvic health PTs on a range across the spectrum. So, you know, people listening, I just want to emphasize that, your therapist that you do find to help you with your pelvic health issues, it's a good idea if they have some trauma informed training, because we don't know what you've experienced. I know what I've experienced. I know I've experienced plenty of medical gaslighting about pelvic issues and otherwise my whole life. And if we have a background in this and we know what our rights are, and we know you're creating the tools for this stuff, for crying out loud, and we still get this treatment, I just want to shout out to all the people with pelvises out there that these tools are available, this care is available, and you have a right to it. And it's not anything to feel shame over.
absolutely.
Yeah. So what's a thing that, because I know you see challenges, being you're in business, as a woman, as a mom, um, and as a pelvic practitioner, like you could pick any one of those things, like as a woman in business, or, as a mom juggling a business, or as a practitioner. What's like your hot topic challenge that you have right now? And like, what would you like to see change for the future so it can be better?
Goodness. I think the hottest one is the one I just mentioned about
Yeah.
equality and visibility and removing the shame and stigma. Um, with regards to being a mom and like, running the business and being busy, I think that there's phases, there's just phases of life, and they ebb and flow, and it feels overwhelming at some times, and there's no such thing as balance. You just have to give your attention and direction in the places where it's needed most, and that's going to fill your family's cup the most. I think I have two little boys, and they know exactly what I do. Not exactly what I do. They have a general sense of what I do, and they have for a long time. They know that I'm a pelvic PT and that I make tools, and that I help people that have sensitive issues. And I think that that's a big step that I'm proud of in the right direction, is that I'm educating them as to that these issues exist. And, when they're old enough to like truly understand and where it's appropriate, like we'll talk more about that, what that entails. And hopefully I'm sending two people out into the world that can continue to advocate, that are going to have a totally different platform in whatever their little lives become, whether or not they're in healthcare or doing whatever makes them happy and brings them joy, that they see that there are ways to just support people and give back.
Yeah. What do you find challenging, I think? And I liked what you said about, there is no such thing as balance. Like I took a long weekend and I so hesitated to use the word hashtag work life balance, because it doesn't exist. But I used it to say that, well, this is what balance looks like currently.
Oh,
I'm taking a
yes.
solo weekend as a mom trying to raise a bunch of kids and run a business and a clinic all at the same time. So I have a question based on that, because I would fully, wholeheartedly, both hands in the air, agree that work life balance doesn't exist. But it's kind of like we don't reach homeostasis, like where everything's just balanced. It's allostasis, like it's a process,
Yeah.
And so I'd think of work life balance like that. What advice would you give to the listeners out there who are, maybe they're interested in being a business owner and making a shift? Because going from a clinician to a product developer is a huge leap. So what advice would you have for someone starting out who is feeling like overwhelmed, because there's not a lot of examples of moms who own businesses who can like sustain it for a long time? So what would your words of wisdom be?
I think first and foremost, carve out and make independent the moments in the day and the days in the year that are non-negotiable for your kids. So for me, that looks like morning, like so morning time when I'm getting the kids ready, I take them to school. So like I do get up early and I do scan through my inbox first thing just so that I can have an understanding of what my day is going to look like. But then the times where it's like breakfast to when I drop them off, it is like we are locked in together, and I make sure that that we're not rushed, and that we are, the three of us are kind of in our flow, so they start their school day and
Yeah.
on that positive step. And then I take their birthdays off like the whole day. Those are their days. Um, and then everything else, I think I really love, and I didn't mean to be like so aggressive about there's no such thing
No,
between balance.
I totally agree. Couldn't agree
But
more.
I like what you say about the allostasis, where there is an ebb and a flow, to where, when there's a fire in your business, you have to put that fire out, because that, you need your business to be healthy. And so there are times where, it's mommy's going in the office and I need to handle some things. I'll be out
Yeah.
later.
Yeah.
But
Yeah.
then like their times are those little moments are non-negotiable for them. So that's where I'm at this particular phase. My kiddos are 7 and almost 10. So, they're still,
So cute at that age.
yes.
They're so sweet. And you are their champion, and you're the sun, the moon, and the stars. I love that age. Mine are teenagers now. And I am not the sun, moon, and the stars. It's very different. But you get love in other ways. When they come and
Yeah.
ask you about a college essay, they want your input, and you
Yeah.
feel, oh, thank you. Like, you know, I do know one or two things. So it's lovely and hard in different ways. But I love that you're doing that. And I often have been guilty of not prioritizing, things, especially when, if you have a moment where, the business proverbial head is on fire or something like that, where it's easy to lose sight of making
Yeah.
the non-negotiable. I remember Brene Brown talking about that. I was listening to one of her interviews or podcasts, can't remember, but listening to her brilliance about putting non-negotiable time on her calendar, on her Google Calendar. And then her agent said, "Oh, you can do it here. That's just a block time." She was like, "No, I can't. And then they would persist, but it's open. You're not doing anything. Yes, I am. I'm doing nothing. That is something.
Yeah, I love Brene Brown.
I loved that. And several years, before I had heard it, it just sealed the message. Then I was like, now I'm going to put some do nothing time on my schedule, because as a mom, you're always trying to make every moment productive. It's a teaching moment. It's a learning moment. It's a quality time moment. And that is putting a whole lot of pressure on ourselves that we already get enough of that from society as it is. Speaking across the range of making pelvic health topics taboo and trying to make tools unaccessible. And then we're also getting the cultural message of, oh, you should just try harder and, all and lean in, that kind of message. It's very stressful, and gosh, that alone, that little mouthful is enough to cause a pelvic health problem already. It's like you can feel your pelvic floor going tension. So everybody, let's take a collective inhale and stretch the pelvic floor out and exhale. So I like that advice. I often couch it and say reverse engineer. Like if I'm mentoring, a young PT or a student, I'll say, block out that time, reverse engineer it. If you don't want to work at night, don't accept a job where you have to work at night. It sounds
Yeah,
so obvious, but I didn't do that in the beginning. I
yeah,
didn't. I was like, oh, I love to teach yoga. I love teaching Pilates. No problem. I can teach a 6 o'clock class. And then all of a sudden I was like, but I don't get to eat dinner. And then when I do, it's too late. And then now I'm up at 2 a.m. So it seems some of those things that seem so, easy, like we would think taking a breath and stretching the pelvic floor is easy, but it's hard. That's why we need tools to do that sometimes to help us learn where the pelvic floor is and how to relax it. So I really like that advice on, being a mom, being an entrepreneur, because it really applies to pelvic health too. Like you've got to carve out that time to sit down and do your homework, whatever that is, whatever that looks like. So what piece of information then would you share? What do you share? Let me rephrase it. There's so much that people don't know about pelvic health, right? Um, and again, I'll use myself as an example. Like going from ortho to pelvic, I learned so much. I felt like I knew nothing when I first started to get into it. So, what's the most surprising thing you usually share with people about the tools or your practice as a pelvic PT that's kind of surprising that you feel like, our listener may not know about yet? What's a really practical piece of information that is that people may not be aware of when it comes to what you do?
think that it's one of the things that I've observed in myself and in my patients is that learning how to drop and relax the pelvic floor
Mm,
is a lot harder than learning how to activate
so
and
hard.
locate. And it's not
Yeah.
to pin, a certain diagnosis against another, but when you're elevated and when you're short and you're tight and you're in a subconscious guarding state, it simply takes a lot more time and practice to come back down to neutral and to learn the coordination piece than it does to go the other way. And
That is
so I
so
think that that just warrants a lot of grace and a expectation of process and
yeah.
time.
Yeah. That is so important to talk about. I see it when I use imaging, in the clinic and I'm trying to I measure someone's inhale and they get 2 millimeters of movement of a stretch to the pelvic floor. And I'm like, okay, we can work on this.
Yeah.
And I think about it in terms of if someone came in with trauma and they're hurting, hurt is trauma, pain is trauma. But maybe they've also experienced some hurt inside the system. Maybe they didn't get listened to. Maybe they feel like, well, they were a victim of medical gaslighting, right? Think about how, when you're upset and you're crying or you're hurt, you're in pain, how long does it take before you feel like you're okay, where you can get up and go make a cup of tea or go cook your family dinner or engage at work again after you've been upset? It takes time. And so if you allow, let's say, if someone was upset and crying about something, they may say, well, it took me 10 or 15 minutes to kind of relax and, and then just pull myself together. That may be what your pelvic floor needs, right? Is maybe it needs 10 or 15 minutes. You can't just expect on demand, especially if someone has kind of white coat syndrome where they walk in, and with pelvic PT, you can be a little nervous, like what's going to happen? Are they going to do internal every time? The answer is no. We're not. um, but if we just kind of acknowledge the anxiety out there about it, and if you're hurting and you have other trauma, yeah, it could take a little bit of time to get the pelvic floor to just relax and go with the flow and to put you back in charge again.
Absolutely.
Yeah. So be patient with yourself, everybody. It's Your pelvic floor won't relax and play well with others immediately.
Exactly.
It might take a
Your
little bit of
pelvic
time.
floor will respond the same if you're upset and someone says just relax,
Yeah.
and it agitates you further.
Yes. That is pretty bad. Yeah. And people hear that a lot too when they go in with a complaint of, if they say I'm having pain with any kind of penetration or um, intercourse or anything like that, and they get the phrase, and you can finish the sentence for me. What are they told? You
Have
know.
a glass of wine. You
Mm-hmm.
just need to relax. Take a
Mm-hmm.
bubble bath.
Mm-hmm. Yeah. And your top wants to just,
Yeah.
just wants to fly off. Your head's on fire. You're like, how dare they say that? But then we can hear it in the medical system. But I also want to encourage people, like, we don't want to gaslight ourselves and say, oh, well, just relax, because
Yeah.
it's not always that easy.
Yeah.
So yeah, I like the word that you used, grace. Give yourself some grace. It's our self-talk is just as important and can be just as damaging as that which we hear from other people, other practitioners that aren't informed, that no, you can't just have a glass of wine and relax your pelvic floor.
If it were that easy, we wouldn't have a caseload.
That's right. We wouldn't even exist if grapes could relax the pelvic floor, but unfortunately, they can't. Oh my gosh. So, what is as kind of, I've got a few rapid fire questions, but my last one is, do you have a favorite thing to teach people that just, like to feel in your work as a pelvic PT to help them just feel better about themselves and hopeful that pelvic PT and pelvic health, because OTs are pelvic health practitioners
Yeah.
too, that it works and that it can help?
Yeah. I use the phrase little by little, a little becomes a lot. And so when we're looking at big goals and dreams and for a lot of people a different life, if they could just get this one symptom under control, or if they could just do this one thing, it's the small work of showing up for themselves. And even if they're having a totally chaotic day and that one thing is 2 minutes of breathing, or they're able to do their full 15 minutes with their wand or all of their pelvic stretches, little by little, a little becomes a lot. And then the other visual that I like to use is that healing looks a little bit like a an upward trajectory when you step back and look at it, but within that there are dips. So you're still moving up and you're still making progress, but there are dips in it. So it's almost like a healthy stock market where, like, over time, if you step back and look at the year, there's growth in that stock. But if you look at
Yeah.
the day by day, there were dips in it. And that's very normal. And that's part of the human experience, that, bad days are going to happen, busy days happen, stressful days, but just, treat the next day as today I'm going to do what I'm able to do. And hopefully that involves all of my things that take care of me. But even if it's just this 2 minutes of breathing right before I go to bed, I've shown up for myself and I've done that thing.
I love that visual. I love that visual. I often use little bell curves in the office and things to describe it, but I really like that kind of 40,000-foot back out stock market view and then in the daily inflections happening. I love that. I hope that helps you guys listening, because It certainly makes me feel better too about a lot of things because we could apply that curve to so much. We could talk about a pelvic floor not relaxing or relaxing, but we can also talk about the dips and the bends and the curves in the road for being an entrepreneur, for being a parent, for just being a clinician, because we want to help and we kind of cure. We want to kind of cure everyone, but it's not a healing isn't linear.
Yes.
Healing isn't linear. So I have a few rapid fire questions for you. Um, what book are you reading right
Oh my word, I am so nerdy. I am reading,
now?
I am reading a book called France, An Adventure History. And so like I do a lot of scientific and pelvic health reading. I just want to preface, like I spend most of my day in that space. So my nighttime reading tends to be a lot in like art history, French history. And this one's really interesting because he covers a lot of these intricate facts about civilization at that time, like Roman civilization, that like a lot of us just aren't aware of. So
Oh,
I
wow.
just started that and it's a good 2 inches thick. So
Oh, wow. Tell me what the name of it is again.
it's called France, An Adventure
France,
History.
an adventure history. Okay. Um, all right, let's stick on the book line. Like, what's your favorite fiction?
Okay, it's called The Midnight Library. It's here in my office right now. I don't read, so I read all the time. I am a voracious reader, but I actually don't read a lot of fiction. And I loved The Midnight Library. It goes through looking at different life possibilities. So the
Oh, wow.
Midnight Library is all of these different life paths that this one young woman could have taken. And it's her each chapter kind of analyzing, oh, if only, these kind of like regrets
Oh,
that she's
wow.
had, and her coming through and realizing that she's on the path that she's on because of daily choices that she made, and she's where she is supposed to be, but she needs to start making different choices to move forward in life. So the Midnight Library.
I love that. I'm pretty guilty of not reading enough fiction. Too. I think I might have once said life is too short for fiction because there's so much nonfiction to be read. But then
Yes.
I felt bad because then there's all these incredibly talented people writing fiction. I'm like, their work is good too. I just don't
Yes.
know how I can have enough time to read all the fiction and all the nonfiction things. So the Midnight Library.
The Midnight Library. I literally feel the same too. But this was recommended and
Oh my
it
gosh.
was
Okay.
good.
Oh, mm, okay. I got to pick that one up. Because I set a book goal for myself every year, and I think I'm a little bit behind this year. So I'm gonna pick up the pace and pick that one up too. All right. Two final questions because I really want to know what you have to say about this because I know you're going to have great answers. The first one is, what do you do? What's your favorite thing to do when you're not like fighting for the cause?
I I'm a very active person. I live in a beautiful space. So I either like to be out running or even just going for a walk. And I love looking at like the wildflowers and the deer and the birds. I've become quite the naturalist in my in my phase of life. So I've recently gotten into butterflies. So I mean, just
Oh,
looking at them, I'm not like capturing them or anything,
yeah.
but I really love nature and being outside and getting my boys outside. So that's a passion area. And then I really love cooking and being in the kitchen. We have a lot of allergies, myself and my boys. So I cook like 90% of our meals from scratch. And I love getting new cookbooks. I love cookbooks and just trying new things in the kitchen and kind of shaking it up a little bit.
Yeah. Oh my gosh, we're so similar. I've been doing that lately and trying new recipes on the boys. And some have been winners. I've had two or three winners. Like, this makes me want to eat dinner, actually, mom. I'm like, oh,
That is the
okay.
best feeling.
It is. It is. Like, that's the reward. That's the ultimate reward for being a parent. It's just that your kid is eating your dinner.
Yeah,
It's good enough for me. Yeah.
that is a love language.
It
Absolutely.
is. Yeah. So, two apps that I just downloaded for the naturalist nerdy person in us. One is a bird call because I was in the mountains this weekend alone and I heard something. I'm like, is that an eagle? It sounded like a bald eagle. So, all of a sudden, I'm looking up bird calls. Of course, there's an app for that. hmm And so I've got to use it. Now I got to use it. I've got to whip out my bird app. but there's a lot of birds around me, and I want to learn more about that because I've never been that bird savvy. So yeah. And then the other one was Peak Finder. It's when you're hiking. Have you used Peak Finder?
No.
All you have to do is hold your phone up as long as you have a little bit of a signal. And if you want to go completely minimalist, then just leave your phone at home and you can do your peak finding later. But if you do have it with you, just point it at the horizon and it shows you in the mountains like what all the ranges are, like 70, 80 miles away. Which is pretty
I
cool.
love that.
Yeah.
It's amazing.
Yeah. So two more tools for the toolbox and a bunch of books. Um, Tell our listeners again where they can find you on social media and on the web.
Yes, on Instagram, we are at Intimate Rose, or I am at A Olson DPT. And then on our website, we are intimaterose.com. And again, hundreds of different blog articles, videos, resources, everything's free on there. We are on Facebook, and on Facebook, we have a private support group that anyone can join. You don't have to have been a customer. It is the Intimate Rose private Facebook group, and
Okay.
they can just go on and apply there. And then we are on a limited basis available on TikTok. the
Ah,
the lighter side of social media. We don't do a ton on there right now. I don't do a ton on there right now, but there are some pretty cute videos on there.
okay. Awesome. Yeah, I've seen some of the things that you've done, and of course, love to follow you and see all your posts. All right. Thank you so much, Amanda, for your time. Thank you for your dedication to the cause. Keep fighting the good fight to keep all of these things accessible and out front for people so that we can ditch this stigma and, move forward with everybody having a happy pelvis.
Thank you so much for having me. I appreciate it.
Absolutely.